As patron of the Asbestos Disease Research Institute, I'm delighted to support the launch of its international E-Toolkit for elimination of asbestos-related diseases. The toolkit is an online training and education resource that will be of enormous benefit to people in developing countries where there is limited information available about asbestos. In February, Adri was designated by the World Health Organization as its collaborating centre for elimination of asbestos-related diseases, a worldwide first. Then in July, Adri was asked by the United Nations Environmental Programme to deliver additional training resources across developing countries. This recognition is testament to Adri's capability and the esteem with which it is held by the international community. I congratulate all involved in the design and development of the toolkit. It is fitting that the toolkit be launched during National Asbestos Awareness Week. Some may view asbestos use as simply part of history. Yet almost 20 years since a complete ban of asbestos use was implemented in Australia, too many people here and around the world continue to lose their lives to incurable asbestos-related diseases. That's why the work of Adri is so important. Its researchers, scientists, epidemiologists, doctors, clinicians and nurses help instill hope and won't stop until asbestos-related diseases are history. To all of you, thank you for making it your mission to improve the health outcomes for people around the world with asbestos-related diseases. You are an inspiration to all.
First, a special thank you to Australia's Governor-General, His Excellency the Honourable Mr. David Hurley. It is such a privilege to receive a message from him. I would also like to thank him for being the patron of the ADRI. So why is Adri developing the toolkit? Number one, asbestos-related diseases plague the world in both the developed countries and the developing countries. Today, an estimated 230,000 people around the world die from ARDs, tragically, every year. Number two, Adri is the world's first and only WHO collaborating center for the elimination of ARDs. So it was only natural for the UNEP to commission the work to Adri that would help developing countries cope with and ultimately to eliminate asbestos-related diseases. Number three, Adri has the right expertise, strengthened, of course, by the network of collaborators. But let me also add that by helping the world, we help Australia, its people, and the country. So here we are today to officially launch the 2021-22 edition of the toolkit.
Nelson Mandela said, "Education is the most powerful weapon which you can use to change the world." The E-Toolkit for elimination of asbestos-related diseases, developed by the Asbestos Diseases Research Institute in Sydney, Australia, aims to do just that. By training the specialists in developing countries to mitigate, identify, treat and care for people suffering asbestos-related diseases, we strive to change the world through education. Our goal is to address the staggering statistic of over 230,000 asbestos-related deaths each year. And to do this, we must do it together. For the past 2 years, an esteemed panel of experts have collaborated and shared their incredible expertise to create a powerful asset to reduce the burden of asbestos globally. Together, we've built an extensive online training and educational resource, which directly goes to the heart of working to mitigate the hazards of asbestos and dealing with asbestos-related diseases. Over time, more and more will be incorporated into the site, ensuring the material is current and relevant and at the cutting edge. The Asbestos Diseases Research Institute, or Adri, was perfectly poised to spearhead the development of the E-Toolkit, which it began in 2019, supported by the Australian Academy of Science Regional Collaborations Program. Under the direction of Professor Ken Takahashi, Adri was designated by the World Health Organization as its collaborating centre for elimination of asbestos-related diseases, signalling its global leadership. Shortly after, the United Nations Environmental Programme, UNEP, signed a partnership with Adri to deliver training resources across developing countries, including Thailand and Zimbabwe. The Karen Howard Grant also supported the endeavour. This is an honour and responsibility Adri takes seriously.
Australia is in a very unique position. We had a very long history of using asbestos. Sharing that experience and expertise with other countries is very important so that the other countries essentially do not follow a similar path of this epidemic of asbestos-related disease.
Education and development is the backbone of Adri's ethos. Our team is dedicated to continually educating and stretching ourselves. We are eager to share those learnings at every opportunity, and we know there are strength in numbers. We believe the more partnerships we establish, the better resources we develop, the more passionately we strive toward a cure for mesothelioma, the closer we edge to ultimate success. The E-Toolkit symbolises a global network of intelligence, and today we are so proud to share that with the world. The project offers expertise on global trends, implementation of national policies, and the enormous challenges and opportunities arising from these policies. It asks, what are the repercussions of major environment calamities? It reveals the situation in Thailand, Mongolia, New Zealand, the Philippines, Korea, Japan, Indonesia, Vietnam and Singapore, as well as Australia, and provides detailed and the most current instruction on diagnosing and treating asbestos-related disease, all while understanding the financial impediments developing countries face to accessing the relevant technology and tools. Pre-clinical research methodologies are showcased and best practice revealed when caring for patients and their families. And critically, it covers reporting, coding and registration of ARDs and industrial hygiene and asbestos waste management. Developed over 24 months, bringing together over 60 specific topics, written by nearly 100 global experts over thousands of hours, and edited by Ms. Diana Arachi and Professor Ken Takahashi. The E-Toolkit is the definitive asbestos-related diseases resource, and today it is being gifted to the global community and to those developing countries who need it most.
The World Health Organization is pleased to see the launch of the electronic toolkit for the elimination of asbestos-related diseases in developing countries. This is an important outcome, as one of the deliverables which was agreed between WHO and ADRI for the new WHO Collaborating Centre. Products such as this e-toolkit are important because exposure to asbestos has been identified by WHO as a major concern for public health. World Health Assembly resolutions have called for global campaigns to eliminate asbestos-related disease and to take action on the preventable cancers associated with this exposure. WHO recognises that the most efficient way to eliminate asbestos-related disease is to stop the use of all types of asbestos. WHO also recognises that it is important to take measures to prevent exposure to asbestos in place and during asbestos removal. We hope that the e-toolkit will provide a valuable reference resource for practitioners involved with the prevention, diagnosis and treatment of asbestos-related disease. The work of ADRI in building capacity amongst stakeholders and decision makers, in particular in low and middle income countries, is an important aspect of the work of this collaborating centre. The E-Toolkit will assist with that ongoing work. The E-Toolkit also includes some WHO resources, including guidance on avoiding exposure to asbestos in the aftermath of natural disasters. WHO looks forward to seeing the E-Toolkit used in technical workshops and at training events in countries in the Asia-Pacific region and elsewhere. Countries need access to the science about asbestos and the options available for taking action. The E-Toolkit can provide an essential link in this chain between the science and policy to actions which can be taken at the national and local level. Countries facing a burden of asbestos-related disease, but with limited capacity and few resources, will benefit from this ongoing work of the WHO Collaborating Centre. I congratulate the staff at ADRI on the launch of the E-Toolkit.
Good day to you all. I am honored to be involved in the official release of the electronic toolkit for the elimination of asbestos-related diseases. This has been part of a long process, and when UNEP required a partner, Adri and Professor Ken Takahashi were always available to assist, and we needed to do more of these training and capacity building workshops, but however, due to the COVID situation, it was impossible. So as a result, UNEP then commissioned Adri to get along, develop electronic tools that can be used virtually to train these countries. Asbestos is a big issue, and we hope that through Adri, their passion and their willing to educate others, hopefully awareness will be raised and countries can do the right thing. I thank you.
After today's launch, my earnest hope is that Adri will continue to engage in international cooperation, because the toolkit is what it says it is. It's only a tool, and it has to be combined with actual efforts by people like us. I will be retiring from Adri next week, but I hope to continue working together with Adri in some way, of course, with my Australian colleagues and international colleagues. Lastly, my acknowledgments, which are many. Supporters of this project are the UNEP, the World Health Organization, the Australian Academy of Science, and Mrs. Karen Howard of the USA, and of course, the ADRF, the foundation of Adri. The toolkit contributors, of course, with Adri's staff at its core, as well as Adri's colleagues, collaborators in Australia and around the world. Real Story did a fantastic job in producing high quality and entertaining videos. My final thanks, but my heartfelt thanks, goes to Kim Brislane, the Director of Philanthropy of Adri. She was the main driver of this endeavor, and she will continue to be. So thank you all.